One of our top priorities is protecting people in nursing homes and seniors. This is where this virus feeds. It's where this virus started, when it started in the state of Washington. We have implemented many safety measures, many of which have been difficult to implement, but we did for health reasons, restricting visitation, except for end-of-life visits. This is a tough policy, and I had serious qualms about it, to tell you the truth. But the health officials were right. Yes, you want visitation. No, you don't want to walk a virus into a nursing home that could kill the person you're going to visit. PPE requirements, all staff have to be checked going to a nursing home every 12 hours. All facilities must notify families within 24 hours, separate facilities, residents from staff in the event of an outbreak. We provided them with millions of pieces of PPE equipment. This is a national problem, right? Nursing homes generally all across the country have seen the COVID virus take a high toll. New York has one of the highest populations of nursing home residents of any state in the country, over 100,000 residents. But New York's percentage of deaths in nursing homes is the 34th highest of any state. So if you look at the states and the percentages of people who died in nursing homes as a percentage of that death, New York is number 34. So none of this is good news, but just to give you a context of what people are looking at. This virus uses nursing homes. They are ground zero. They're the vulnerable population in the vulnerable location, right? It's a congregation of vulnerable people. Today we're taking additional steps to protect seniors in nursing homes. First, I want people to understand how a nursing home operates vis-a-vis the state. The most vulnerable population deserves the highest level of care, right? So the rule is very simple. If a nursing home cannot provide care for a person and provide the appropriate level of care for any reason, they must transfer the person out of the facility. If they can't find another facility, they call the State Department of Health. So what does this mean? If they don't have enough staff, if they don't have enough PPE, if their facility doesn't allow for isolation or quarantine, whatever it is, if they cannot provide the proper care, they must transfer the resident, period. If they have a COVID positive person and they can't treat a COVID positive person, they must transfer the person, call the State Department of Health, and the State Department of Health will transfer that person. All nursing home staff must now be tested twice a week. That's not just a temperature check, that is a diagnostic test. We have the tests available. We have brought them online. The state has more testing capacity than any state in the country. They have to test their staff twice a week. That is a rule. It's not a, I'd appreciate it if you did. Hospitals, going forward, cannot discharge a patient to a nursing home unless the patient tests negative for COVID-19. So we're just not going to send a person who is positive to a nursing home after a hospital visit, period. Remember, and I want the nursing home operators to understand this, we have alternative facilities for nursing home patients, COVID or non-COVID. Remember what we did here. We created 40,000 hospital beds. because we had to. We had a 50,000 bed capacity system. The early projections were we would need 110,000 beds, 140,000 beds. We created 40,000 additional beds, minimum. So we have beds available. We also set up COVID-only facilities. So we have available COVID-only facilities that could accept nursing home residents. We're not reducing the number of hospital beds that we have available. We've always had more hospital beds available than we've used, always. There has not been a day that we didn't have more beds available than we've used. So if a nursing home cannot take care of a person, we have facilities that can. And I understand the nursing home's perspective. But if they cannot provide the appropriate care, they have to call the Department of Health, and let's get that resident into an appropriate facility. I can't be more direct about that. We have available COVID-only facilities upstate as well as downstate. So we have the facilities available. If there's any issue, the resident must be referred to the Department of Health, which will find alternative care. If a nursing home operator does not follow these procedures, they will lose their license. Well, that's harsh. No. Harsh is having a nursing home resident who doesn't get the appropriate care. That's what's harsh. Having someone's parent or mother or brother in a situation where they're in a facility, they can't even get a visitor, they're isolated, they feel alone, and they're not getting the appropriate care. That is what is harsh. And if that's what happens, then that facility operator should lose their license. I have no problem with that. I was the Attorney General. I did investigations of nursing homes. I have tremendous respect for what they do. But this is the essence of their responsibility and obligation. Again, we have the facilities. We have the beds. It's not like a situation where there are no options. We have options, and we want to use them. So if there's any reason why you can't provide appropriate care, let us know, and we will put them in a facility that has it.